We're back with Dr. Karina Passy with Cone Health Dermatology. Of course, we're talking about taking care of your skin no matter what season it is. So let's talk about some year-round skin recommendations that may get overlooked.
So I'm going to sound like a broken record, but it's going to be moisturizing throughout the year. Again, the best time to moisturize is actually going to be after your shower or your bath. You should pat dry and then use ointment or a cream. I have a couple of examples here. So this is a good cream. It comes in a thick container where you can squeeze it out. And then ointments like Aquaphor or Vaseline, those are going to be thick and greasy. They actually help trap the moisture that you got from your shower and help keep that in your skin. So that's a great way to moisturize, doing that all year round. And then again, it's going to be your SPF 30 or more daily on your face, your hands, your neck, your sun exposed areas. And then thinking about wearing wide brimmed hats, those help kind of protect the sun from hitting those parts of your body that you might not realize are getting daily sun exposure. And there are a lot of different brands and different concoctions out there that are at all price points, including really good, relatively affordable options on Amazon.
Okay. When it comes to like the winter time, I know everybody's hands get like all dry and cracked, and because that's what we're working outside and we don't put our gloves on and all that kind of jazz. So what steps can we take to help prevent that and treat that?
Yeah, so the best thing to do is trying to get ahead of it before it gets to that point. So if you think you're prone to those changes in the winter, you may actually have a mild form of hand eczema. Those changes are consistent with what you're describing there. So again, you're going to want a really good emollient, meaning ointment or cream, probably wanting to carry that around with you in your car, in your purse, and moisturizing basically anytime you're stripping your skin barrier. So if you're washing your hands, if you're using hand sanitizer, if you're eating, things like that, you want to reapply. And then if it's still consistently bothersome, despite really good efforts to do that daily, then it might be time to go see your board certified dermatologist, and they may need to give you some prescriptions to help you get kind of past that point.
All right, let's talk about any kind of acne or pimples or things of that nature. People always want to squeeze them, and they think that that's going to make them go away. What do you say?
Yes, I think it's human nature. I try not to do it myself. In general, picking at your lesions, no matter what they are, is much more likely to lead to permanent scarring. So even though that's in our nature and we feel really strongly we just want to get rid of it, more than likely you're going to leave a permanent mark there. So if it's an acne bump, you may need to let time go by. If it is like a lipoma or something more chronic or a cyst, then you should come see your board certified dermatologist. And if it's something that's bothersome to you, then it may be time to discuss getting that removed in our office.
Okay, so don't squeeze it, let it go. Is it okay to put like the acne cream on it?
Yes.
Okay.
There are a lot of products like hydrocolloid dressings. There's a lot of good products out there for acne bumps that are active and probably likely going to go away. But if it's those chronic lesions that have been there for, say, years and you're just frustrated and you want it to go away, it's much better to come in before it gets scarred down so we can take care of it in a much, much better cosmetic way than once it has scar tissue associated with it.
Okay, what skincare myth do you frequently encounter that you would like to set straight before we go?
I think one big thing is the misconception that getting a base tan means you're off the hook for the rest of the time, especially in the summers. The base tan you're getting is your skin trying to actively, quickly protect itself from the intense sun exposure that you're giving it, but that does not mean that the cumulative UV damage does not continue throughout that summer. So base tans are a myth. You are still getting the same amount of sun damage. It may seem cosmetically pleasing in the moment, but there are great sunless tanning options nowadays that give you that same glowing look without all the damage.
The base tan is a myth.
That's right.
Okay, don't do that before you go away for spring break. All right, we appreciate your time and your expertise. If you missed any of this, maybe you need to send it to someone who's asked some kind of question like this before. It's going to be in the To Your Well-Being section of our website.